Good morning.
Morning.
How is everyone? Yeah? That's good. Are you guys all ready? Excellent. Well, welcome to Undurba State School. This is a vaccination clinic today. We have vaccination clinics right across the state. And so if you haven't got your kids vaccinated yet, before going back to school on Monday, today's a great day to do it. We do prefer appointments for children, but if you walk in, they'll still vaccinate them. And so please consider this weekend going and getting vaccinated. We're making it as easy as we possibly can, including at sites like Undurba. You all saw yesterday the stockpile of rapid antigen tests being deployed out to schools so that they have them for the return to school on Monday, the full return to school on Monday. While I was there, I grabbed the box for Undurba State School, and I'm hand delivering those today to Emily, the president of the PNC, and Leanne, the principal, who's also here with us. Today we're reporting 8,508 new cases of COVID-19. That includes 2,730 positive rat tests. Our active cases sits at 49,639. We tested 23,968 samples in the last 24-hour period. Tragically, 21 Queenslanders died over the last 24-hour period. The Chief Health Officer will go into more detail on that. We have 727 patients in total in public hospitals, including 46 in ICU, and in addition 63 patients in private hospitals, 2 of which are in ICU. And we're now at 89.85% of Queenslanders over 16 double vaccinated. They're the COVID stats for the day. I'll hand over to the Chief Health Officer, and then Emily from the PNC can say something about the return to school.
Thank you very much, Deputy Premier. Sadly, we have 21 deaths to report today. That is in fact the largest number of deaths we've reported on a single day. This includes 2 people in their 60s, 4 in their 70s, 11 in their 80s and 4 in their 90s. 4 of these people were not vaccinated. 2 had received a single dose of vaccine. 13 had received 2 doses, and only 2 had received a booster. Only 2 out of 21 people who died in this reporting period. 7 of these people were known to be aged care residents. And it just distresses me greatly every day to be reporting on older Queenslanders who are dying without having received the booster. We know that the booster, that 3rd dose of vaccine, is absolutely critical in protecting us, particularly older people, from more severe disease, hospitalisation, intensive care admission and death. And I just cannot state this often enough. As we get older, our immune system matures and changes such that we respond to new viruses in a different way. And we know that the older people are particularly susceptible to the effects of this virus. And the booster is absolutely critical. And we know that that booster, that 3rd dose, is very protective. And this message really needs to get across. We know that most of these people who have not received the booster are not anti-vaxxers. They want to get vaccinated. They've already received 2 doses of the vaccine, and for a variety of reasons, they have not yet received the booster. I hear stories about elderly people who have dutifully made their appointment with their general practitioner 4 weeks down the track. There is plenty of booster out there. It is available at multiple locations. There is no need to wait to get boosted, particularly if you're an older Queenslander, provided you've passed that 3-month period. We do know that 70% of Queenslanders over the age of 70 have received the booster. It's only 30% who have not, and yet over 90% of the people who have died in this reporting period were unboosted. So if you are an older Queenslander, if you've received 2 doses, you haven't received your booster, whatever you're doing today, please organise to receive that booster in the next couple of days. Please do that now. It's critical. The good news is in our public hospital system, the numbers of patients in hospital continues to decline gradually down to 727 from 732. This is a gradual decline in admissions in hospital, and this clearly again demonstrates that we are past the peak of transmission in the community across most of Queensland. We are increasingly confident of that the transmission is decreasing. We know there'll be a lag as people get discharged, as in terms of hospitalisations and intensive care admissions and deaths. There will be a lag in that, but the peak of transmission has certainly passed. But the virus is absolutely everywhere in Queensland. It's in every corner of Queensland, and we know that large numbers of people carry the virus and have no symptoms. So there is no way that you can avoid being exposed to this virus in the coming weeks. So it is inevitable, although the peak has passed. So that's certainly good news that peak has passed. In terms of the private hospitals, we have the numbers in the private hospitals have also declined, down from 66 yesterday to 63 today. One thing I was thinking about last night that maybe maybe it's obvious to me, but not necessarily obvious to everybody, is even though we say there were 732 people in hospital yesterday and only 727 people today, that doesn't mean there were just 5 people discharged from hospital. Maybe that's not obvious if you haven't thought about this much. In fact, we admit about 150 to 200 people to Queensland hospitals every day with COVID-19 at present, between 150 and 200, and we discharge slightly more. That's why the net number is going down by a few numbers. It's not like they're just 5 people that have been discharged from hospital. The virus is out there, although the numbers that we're seeing, the number of presentations, the number of admissions is declining, but it's still 150 to 200 a day. So again, I just can't say this often enough, particularly for older Queenslanders, please get that 3rd dose. It is protective. It protects you from being admitted to hospital, it protects you from being admitted to intensive care, and it will protect you from dying from this disease. Thank you very much. I'll now hand back to the Deputy Premier.
Morning. I guess I will just say that we are looking forward to welcoming the kids back to school on Monday and supporting them in their learning and, you know, getting back to a little bit of normality and routine for them. So that'll be very exciting for us, and yeah, we look forward to seeing everyone on Monday.
Great, and I'll take the test with you.
Yeah, thank you, Stephen.
Thanks, Emily. Yeah, of course.
Yes.
Well, it is concerning. I mean, there are Queensland Health aged care facilities, and we have active process to get those individuals boosted. But there is currently no process by which Queensland Health can get information from the aged care facilities. Although we are sharing information with the Commonwealth, and we do want to collaboratively sort this issue out. We need to sort this out because it's very concerning, and so we are discussing this. I'm discussing this with my Commonwealth colleagues about sorting out how we can make sure that everyone in residential aged care facilities gets access to that booster, because these are not people who don't want to be vaccinated. Somehow they're people that seem to have got lost in the system, and that's greatly concerning to me. So, but we are collaborating and we are trying to get this sorted out. But ultimately, it is the responsibility of the Commonwealth.
If there are family members out there who desperately want their loved one in an aged care home to be boosted and they're having trouble getting that done, what would you recommend they do?
Well, we've all heard these stories. I mean, certainly, if it's possible for the family to take them out and get boosted on the weekend, there are plenty of places that you can get your family member boosted for outside the aged care facility if they're not able to provide it immediately.
Should they be insisting that they are able to take their loved one out to go get boosted?
Well, they certainly should be able to. Yes, definitely, if they're able to. Yes.
Bethania, an aged care home down there, Gerrard Gardens, I understand is in a quite a dire situation. Do you know how many people have died at that aged care home?
It's a private facility. It's a Commonwealth issue. I don't have those data.
And do we know of the COVID deaths in Queensland so far? How many of them are from aged care homes? What is that situation like at the moment?
There are 134 people, and it's I don't have the total number of people who've died in Queensland. It's roughly half, or maybe slightly over half, I believe, at present. It's 134 in total that have died in aged care facilities in Queensland. Well, I think the main thing is for people in aged care facilities to get the booster. That's the solution. The solution isn't more restrictions. The solution is getting the booster, because we know the booster works. So more restrictions is not the answer.
Dr. Gerrard, back to Jeddah aged care. Do we have any updates on the situation there? There was rumours that they've been evacuated. Do we know?
I don't believe that they have been evacuated, but it is a private Commonwealth facility, but I don't believe they have.
And they haven't reached out for any state assistance?
There's some involvement, I believe, but look, again, it's a private facility that I can't share any more information about.
Look, that was the facility that I was aware of yesterday when I made the remarks that I made yesterday about the situation in aged care. I don't think it's a solitary example, tragically. We know that nationwide more than 1,000 facilities are dealing with outbreaks, and the impact of them is not just on the people who may die, although of course that's tragic, but the effect of workforce shortages and how that is playing out on the lives of individuals in those facilities is, it's almost cruel. You've got people who are being locked away, isolated, not able to get the level of support and care and assistance that they are used to and frankly they deserve. You've just heard about half of our deaths have been in aged care facilities, and most of those are residents who have not been boosted. There's really no excuse for that. The Commonwealth made commitments about vaccinating people and staff in aged care, and clearly they've failed to do that. And as a result, people are living in circumstances right now that they should not be, including at that facility.
Have you had any updates yourself on Jeddah Gardens and the situation there?
I haven't heard much beyond what's been reported publicly. I spoke to someone yesterday who was a relative of people in that facility, and they were very, very concerned. The situation there has evolved over days and weeks, and look, I'm really concerned for the welfare of those residents, but I think it's just one example of what's happening right across the country under this Prime Minister's watch.
Chief Health Officer, from Monday, referrals are needed for private testing clinics. Do you think that will have an impact on Queensland's approach to I guess, our COVID response and knowing what the numbers are like? And
Referrals are required for private testing clinics.
Private testing clinics from Monday, is that right? At Sullivan, Nicolaides, some of those places?
I have to admit I had not heard that, so that's news to me. Well, certainly we have capacity in the public testing clinics for children. If any children have any symptoms at all, and we know that children get very mild symptoms when they get COVID, we certainly have capacity to do PCR and or RAT testing through the public health clinics, through the public hospital and Queensland health clinics. So we really do. So children, as we know, get very mild symptoms, and it may be difficult to recognise COVID-19 in children, but we would prefer if any child gets at all unwell that they get tested in one of our clinics rather than coming to school, if that's what we would like, to prevent transmission. And if I do want to emphasise this. The immune system of a child is very different to the immune system of someone over the age of 60. Children and young adults have a very robust, what they call an adaptive immune system. So children are able to recognise new viruses very specifically. Their immune system is able to recognise new viruses, and that's why they don't get sick. Once we pass 40, our adaptive immune system starts to change, and we have a different type of immune response, and we're not as good at recognising new viruses. Like, we're not as good at learning new things as we get older, and that applies to life as it does to new viruses. And that's why older people particularly require the booster. So parents should not be unduly concerned about their children and COVID-19. Also, we know that transmission, the peak of transmission has clearly passed. But this doesn't mean there won't still be cases within school. But I must emphasise the immune system of children is very different to the immune system of someone over the age of 60.
Is there any areas in Queensland that, I know that you said a while ago that the parts of the state would reach their peak at different times. What areas have passed their peak? Pretty
well most parts. Cairns seems to be well past its peak, pretty well everywhere. There might be some more remote areas that are new, the smaller areas, but most areas seem to be past their peak of transmission. So we're on track, and I think the decision to keep schools closed, just that extra couple of weeks, was a good one. But I must emphasise to parents, I would not be unduly concerned about this virus. I know there are a lot of anxious parents out there. Please don't be. There may be some disruption in this first term because kids may well get it and have to isolate, and the families may have to quarantine. Yes, that will be disruption. I think that'll be the biggest problem rather than the true illness in their children. The other risk with children getting it is the risk of them transmitting it to their grandparents, and that again must emphasise that's why it's so important that the grandparents of small children get those boosters.
Are you satisfied with the amount of children that are vaccinated before the return?
I think it's fine. I think this level of vaccination in children is fine. It'll continue, but it's fine. The main thing is the elderly and the boosters in that elderly age group. We'll get more children vaccinated. It'd be nice to get a few more teenagers vaccinated, particularly those that have important exams to do in the next few months, because the infection more than anything else will disrupt their schooling. More than actually that I'm concerned they will get unduly sick. A rare serious illness in young adults and adolescents, children happens. It does happen, but it's very uncommon. But it will be disruptive. It will be disruptive to their school life, and I think that, to me, is going to be the biggest problem, particularly for teenagers sitting their higher exams.
What's the background, sorry, for the two lots of age group children?
Do I have that here? I've only got it for children aged 5 to 11. It's 37.88% first dose, and I don't have it for adolescents here today, I'm afraid.
If we just touch on World Camp, there's fewer than 11 passengers arriving there today with a 500-bed capacity. Do you stand by the need for this facility?
Yeah, this is day one. I know that the staff there are very keen to get their first guests in, but we are keen to start small and build upwards from there so that we can test our systems, make sure that everything that the staff need there to take care of those guests is there. We're expecting more people over coming weeks.
When will you reveal how much this facility costs?
Well, as we indicated, this is a lease arrangement, and lease arrangements generally are considered commercial in confidence.
Can you clarify exactly who's arriving today? Are they workers, international students?
So I understand the cohort that's going there today are unvaccinated international arrivals.
Deputy Premier, where is the Premier today in the middle of an integrity crisis?
Well, as I indicated yesterday, the Premier has held a lot of press conferences over the last few weeks. As you might expect, she has other work to do.
The former state archivist says a lack of proper record keeping by the government contributed to Mason Lee's death. Why won't you commission a wider review into integrity?
Well, you might have seen that he has since clarified his remarks. He has expressed regret that that article was published as it was. He said that the article does not reflect his views. And I think, whatever the politics around this, we don't need to drag Mason Jetley into this. His death was tragic. Our community is still hurt by it and recovering by it, and I just urge everyone to take a bit of caution in trying to make political points out of this. The former Executive Director of the State Archives has issued a statement saying that he doesn't want us to, and despite the reporting this morning, I'd urge others to take that on board.
A Labor backbencher says the growing question of integrity is the most concerning thing your government has faced, adding that where there's smoke, there's fire. Does it concern you that even those in your ranks have doubts about the integrity of your government?
I think even Hayden would admit he had to work pretty hard to turn those quotes into the story that it was. I talk every day to our MPs. They're never backwards in telling me what they think, and they've not expressed views of concern. Obviously, the continued mud being slung by the opposition leader, our MPs would prefer not to see that. But they know, and if you look further at those quotes, they indicated that the government is following the appropriate process in every case.
DP, isn't it concerning that you said yesterday say that it was the LNP thing, but there are Labor MPs who have raised concerns about the government's handling of it. Why is it not appropriate for the government to simply put the matter to bed by announcing a widespread review into integrity?
Well, because I said yesterday, we have a Royal Commission into integrity every single day. That is the Triple C. That's the Triple C's job. And every single matter that has been raised either has been investigated or is being investigated by the appropriate body, in many cases, the Triple C. Now, I understand there have been questions about the Triple C, and they are legitimate, and that has been looked at in detail by the PCCC, and we've adopted all of those recommendations. But once you address the concerns about the Triple C itself, it is the Triple C, which is the standing body, who is the most appropriate place to investigate all of these other matters that have been raised.
Do you accept that none of this reads well for the government right now?
Oh, look, a lot of mud has been slung. A lot of things have been said. But at the end of the day, there is no new evidence provided by the Leader of the Opposition that would justify any of the claims that he has been making. They are all either being investigated or in the process of being investigated, and that's the appropriate thing. And as I say, even those anonymous remarks quoted today said that the government was doing the right thing, handling them through the due process.
And I know you've been asked this yesterday, but do you think the Premier is fit to stay in her position while this saga continues?
Oh, of course I do. None of this goes to her or her performance. She's doing a great job, and I am honoured to work with her every single day.
DP, back to Wellcamp, do you still stand by the facilities necessary with the border arrangements and everything like that?
Oh, look, it's more than 2 years into this pandemic, and I've tried a lot of times to predict what would come next, and I've been wrong as many times as everyone else has. I have no doubt that there will be an ongoing need for accommodation. That need might change. Sometimes right now, we have a number of unvaccinated arrivals. We have people coming from countries whose vaccination programs aren't recognised by our TGA. And we have maritime arrivals. We have ag workers who have to quarantine before going onto farm. There is significant demand. We continue to have, I think, 10 hotels in our hotel quarantine program, underlining how we continue to have this need for accommodation. And I'm certainly pleased to have purpose-built accommodation available. I wish it was available sooner. You know, I wish we'd had this facility sooner, but now that we have it, we'll certainly be using it.
And what do you make of these text messages from Barnaby Joyce about the PM this morning?
Well, I don't often find myself agreeing with Barnaby Joyce. You know, the Prime Minister's a liar, a hypocrite, a complete psycho. These aren't the things I've said. These are things his friends have said. These are things that people who know him have said. And I think, you know, they certainly ring true according to my experience of dealing with him and his government.
Thank you.
Thank you. I have a 7-year-old to get from dance class, so I'm going to run. Thank you.
Thank you.